Good afternoon. My name is Katrina Moog, and I am responding to the self-teaching discussion board of which we are to assess how we are going to teach this mother who just delivered a newborn baby, and pain management seems to be an opportunity. For the simulation with the new mom and baby, pain management assessments and teachings are very important. As a nurse, we can ask patients how their pain is, but sometimes you are able to assess the pain. You are not able to assess the pain because it is subjective. With a new mom that is probably experiencing pain due to her delivery, it is important to assess if her pain will interfere with her management of being a new mom. First, I would complete a pain assessment. I would ask her where her pain was, the type, and the intensity. I would also ask her questions like what makes it better or worse. More than likely she has pain associated with post-delivery, but it will be important to assess if it impacts functions of daily living and can be relieved by mild anti-inflammatories. I would let the mother know about the usual prescriptions that mothers go home with and other options such as sitz baths for pain management. Next, I would have an honest, non-judgmental conversation about the mother's history of drug abuse or addiction. I would explain that in order to help her be the best mom she can be, it is important that she be honest about her current use of prescription or street drugs. Depending upon how this conversation goes is how we will proceed. When assessing the patient's pain, it is always good to see if the pain she is describing is matching her affect or demeanor. If it does not match, that should be communicated to the provider. For instance, if she states that her pain is a 10 out of 10 and is the worst pain she could ever experience, but she's also talking on her cell phone, she can be seen laughing and acting as if she has no worries or pain, then that is a concern. A palpated exam should take place as well. Pain after delivery can be a sign of a very serious medical condition that should be assessed by the provider right away. During this exam, it is important to educate the patient about normal expected pain after delivery and pain that should be communicated to her provider right away that might be a sign of a serious medical condition. Next, I would evaluate her vital signs. Pain can cause increases in blood pressure and heart rate. I would look at her temperature to see if she is febrile. I would educate the mother about the signs and symptoms of medical conditions such as hemorrhages or sepsis after deliveries, and these can cause changes in vital signs and changes in the normal appearances of her abdomen. I would then ask the mom to repeat back everything we have discussed thus far. If she's able to teach me back a good portion of what we discussed, then I would feel comfortable about her discharge. If the mom insists that standard anti-inflammatories are not helping her with pain, then I would notify her provider. If there is a documented history of drug abuse or addiction, I would ask that social services come in to speak with her so that they could follow up with her after discharge. If the patient takes drugs and is addicted, then it would explain why she's asking for narcotics upon discharge. It could be a case of addiction or her wanting to sell the pain medication for money or drugs. During this assessment, it is important for the nurse to remain compassionate and sincere in her questioning. The nurse is helping someone in need and should act as a provider for this patient population. The mission of Bon Secours is to help those in need.